Thank you, and I'm really happy to be here. I'm happy to be the West Coast representative at this meeting. I'm blown away by all the amazing things that EPA is doing and NIEHS is doing right now in the setting of all of the limitations that we already heard about in this morning's sessions, and the need to get a handle on all of these chemicals that are out there. At the state level, we can't compete, frankly, and we don't want to. We want to figure out ways that what states are doing can be complementary to, can help move forward issues around prioritizing chemicals, identifying issues of concern, or taking action when necessary. And so I'm going to be talking about three different programs. I'm actually going to skip this and I'll get back to it. Three different things that we have going on in California right now that I think are relevant. Our CalEnviroScreen project, the California Communities Environmental Health Screening Tool, our BioMonitoring program, and what everybody's been waiting for, I guess, our Safer Consumer Products program, what used to be called, the program formerly known as Green Chemistry. Actually, the reason I put up the Science and Decisions framework at the beginning is that what one needs to do in terms of priority setting depends on where one is in the process, in terms of screening or problem identifications versus getting, testing information, doing risk assessment, or moving on to risk management. So that framework across the top gives you, there are different priority tools that you need for each of those. And so these different approaches are at different places in that continuum, ranging from the sort of screening place all the way through to the risk management place on the, in that approach. So to jump right into the CalEnviroScreen, this is an environmental justice screening tool that is statewide. It was released in its version 1.1 last spring, 1.0 last spring. 1.1 was just released a month ago, and we're now jumping all the way to 2.0 in a few months. 17 different indicators so far in there, metrics that reflect pollution burden, reflect exposure indicators, such as pesticide use as a potential indicator of exposure, various air quality indicators, even things like traffic, down to environmental effects indicators, which are weighted a little bit less than the exposure indicators, things like impaired water bodies, leaking underground storage tanks, toxic cleanup sites, et cetera, all the way to vulnerability factors, which in our screen range from poverty, educational attainment, linguistic isolation, and health vulnerabilities, including asthma, ER visits, and low birth weight. And so this is all put together since it was developed by risk assessors. We actually take the pollution scores and we multiply them basically in a sort of a hazard multiplier approach by the population vulnerabilities, and then show them as a percentile all across the whole state. So you end up with a map like this, which shows the top 5% and the top 6 to 10% of statewide zip codes, highlighting the Central Valley, the Imperial Valley, and LA. Big surprise, certain areas of each of those. But why am I talking about an environmental justice screening tool in the context of chemical priority setting? Well, the reason I want to bring this up, actually there are two reasons. One is that, that looking at the community level can tell us things. And I think Bill Halperin made that point a little bit this morning, that you can pick up things when you look at what's going on in communities around the country and around the world. And so that is one reason. And then the other reason is that it really has done that for us in California. So, for example, perchlorate was not thought particularly to be an issue until it was identified in the drinking water supply of the town of Rancho Cordova in California in 1997 because of the development by our Department of Public Health of a new test that had a lower limit of detection. And so this was a community that was already known to be impacted from a Superfund site. And so testing of the water supply was a reasonable thing to do in honing down to look at the risks to that community. And lo and behold, this chemical has now become a fairly significant priority nationwide. Hexavalent chromium, similarly, whatever you might think about the disease cluster in Hinckley, California, and the resulting investigation by Aaron Brockovich, et cetera, this was something that brought the question of, okay, well, we kind of know that hexavalent chromium is bad if you inhale it, but what happens if you ingest it, to the forefront? And that was an important question to answer and has turned out to be something where the answer is important for public health. So switching now to the second program that I want to highlight, the BioMonitoring California program. This program was established in significant part because of the detection of the polybrominated diphenyl ether flame retardants in breast milk. These were first identified in Sweden in the late 1990s, but very soon after the Swedish studies were published, the California Department of Toxic Substances Control Laboratory adopted a method for monitoring for these and found and reported on them in two settings. One was harbor seals that died and washed up in the San Francisco Bay, and the other was breast biopsy specimens from women in the San Francisco Bay Area. And when you actually lipid adjust the Swedish numbers and the San Francisco Bay Area human samples, find actually a 40-fold higher level of PBDE flame retardants in California. This got folks' attention in the state and in the legislature, and at least two of the PBDEs were banned the following year in California. And it was because of that, though it did take several years and several tries to get the California Biomonitoring Program established, but it was really because of that example and because of the realization that biomonitoring can in fact be useful for identifying new priorities, new chemicals that we weren't really thinking about, that this program was created. And so how do we do chemical selection and priority setting in biomonitoring California? Well, there's two pieces that go into it. One is the chemicals that CDC is looking at, because we start with those. But then we decided to move beyond that and created a scientific guidance panel that can designate and prioritize chemicals that are outside the CDC federal biomonitoring program list. And in fact, we've tended to focus on chemicals that are outside because we feel that the CDC is doing a very excellent job on what they're working on, and so we want to be value added. So how do we make those? How has the scientific guidance panel actually done that kind of priority setting? Well, interestingly, a lot of what the conversations in that science panel focused on were, well, what chemicals do we have any reason to believe might be different in California or specifically might be increasing in California? And one of the things that they looked at were, well, okay, what chemicals are moving off the market for some reason, because they're banned, because they're restricted, or because there have been shifts? And what do we know about what's coming in to replace them? Because those should be ones that we should be looking at for biomonitoring. And so these are the categories that were identified: flame retardants, phthalates in toys, because there was a bill in California before the one in the Consumer Product Safety Improvement Act here. Bisphenol A in baby bottles and other uses, also subject to legislation in California. Because of some of our air quality and ozone issues, the Air Resources Board, which is part of Cal EPA, has taken action to reduce VOCs in various contexts. And so one of the big issues is that perchloroethylene in dry cleaning is being phased out statewide, what is coming onto the market, such as this green earth cleaning substance, to replace PCE? And what about some of these lower VOC solvents that are coming in to replace volatiles that are being restricted in other settings? So that has resulted in a number of chemicals, and more specifically and interestingly, chemical groups being listed as priorities for the California BioMonitoring Program. So brominated and chlorinated flame retardants, there was a decision, even though this is a somewhat disparate group of chemicals, to actually look at them together because of the functional, because they are used in similar niches. And so there was a decision by our scientific guidance panel to take a look at all of the brominated and chlorinated flame retardants. There's going to have to be additional prioritization within those, but our laboratories are working on developing methods to screen for as many of those as they can. And we'll just see, we're going to learn a lot based on what pops up. Then there was a realization that, well, and it's not just those classes of flame retardants, there are also non-halogenated aromatic phosphates that are being used as flame retardants. So that resulted in an interest in looking at those because they are, there are some toxicity concerns associated with those as well. And then a broad category of various bisphenols that are, some of which are potential replacements for bisphenol A and others of which are, have somewhat different uses, but they were grouped because of their chemical class. And the cyclosiloxanes, which are, at least one of which, D5, is a replacement for perchloroethylene in dry cleaning, were identified for that reason. So there are also some categories of chemicals that were looked at, and the decision was not to prioritize them, including synthetic hormones used in food production, antimicrobials used in food production, which were not prioritized in part because they were too disparate in their classes or because it was not going to be possible to effectively biomonitor for them, or because there was not any clear evidence that there was a California specific concern related to them, because we were trying to look at issues that might specifically affect our state. So that is that's yet another approach to priority setting. And then our newest toy in the BioMonitoring California program is a TOF, a time-of-flight mass spectrophotometer, which is actually just about to be installed in our laboratory, and we hope that we can get the funding for an operator to use it. This allows for broad screening and identification essentially of unknowns. You basically do non-targeted testing, exactly what it seems like. You're not looking for a specific thing, you're just looking to see what signatures match up with what chemicals are already on the market. It's a great screening tool. It's less good if you're really trying to quantify down to low doses, and you definitely need follow-up assessment to make sure that you're detecting what you think you're detecting. But, if you sample a whole lot of people and start consistently seeing something that you weren't really expecting to see, seems like it's time to develop a method and start specifically looking for that in populations of interest. So it's definitely a very useful tool for priority setting, in my opinion. So the other issue, though, is that if you have a tool like the EnviroScreen, which is geographic, and a tool that is tool that's biomonitoring, you're catching some of these issues, but a lot of the things that people are exposed to are what's in their homes and their consumer products. And that takes me to the, with 1 minute left, the safer consumer product regulations, which we can talk about more later. But the priority setting in here is actually not as interesting as it could be, because we're largely relying on lists from others. So there are, I believe it's 27 lists in there right now and approximately 1,200 chemicals or chemical groups. This is more of a risk management kind of program, and so we're not trying to reinvent the priority setting wheel here. We're trying to more focus in this program on getting companies to do to look at alternatives and to move gently towards safer alternatives. Our initial list is a little smaller than the 1,200. It's about 200 candidate chemicals, from which we are, in the next couple months, going to be releasing our first list of candidate chemicals in consumer products. Our first list is very small. It's going to be 5 priority products. And it's really, 23 authoritative lists. So, it's only going to be 5 priority products in the first round, and then right after that, we'll be putting out a work plan and doing a much more ambitious list. But the plan here is difficult because, as I mentioned before, looking at a chemical in a product is really tricky because there's a lot of there's just so little information out there available to agencies on really, which chemicals are being used where. And I have lots of examples of, people who on my staff who are like phoning up, home repair companies or driveway, repair companies saying, I want to get a quote on this, and can you tell me what products you use, and can you send me the names of what you're actually selling, or going to, the big home improvement stores and looking at what's on the shelf, and we're just scrambling to try to figure out how do we actually figure out what is used in California and what amounts that, and in some product categories, it's a lot easier than others. And yet we do have the burden of showing that there is potential for exposures to contribute to or cause significant or widespread adverse impacts, which is not horrendous burden, but it's enough of a burden that we actually have to make some findings. And so we have to show that it's out there. And that's been an interesting challenge. So in summary, there are different kinds of approaches for priority setting depending on if you're doing screening or assessment. And these are some of the different things that we're looking at in California. And I will, I guess there's no questions, so I'll just leave that up there because it has my contact information. And thank you very much.
Thank you. I could guarantee that there will be questions during the discussion period, so be ready for that. Heather Patterson is a senior evaluator in the Healthy Environments and Consumer Safety branch of Health Canada, which is Canada's equivalent of our HHS. Having worked on the assessment of existing substances under the Canadian Environmental Protection Act for more than a decade, she's been part of many science and policy initiatives to advance the assessment and management of industrial chemicals, including the categorization of the Canadian Domestic Substances List. Her current work involves developing innovative approaches for prioritization and assessment. Heather Patterson.